We were privileged to have not one but two distinguished female doctors with us tonight, Dr. Deborah McMahan and Dr. Linda Malkus. Dr. Malkus works down at IU at the Vera Bradley Foundation for Breast Cancer, and I've gotten to know her over the past few years, and I have to tell you, Alyssa, that when I hear Dr. Malkus speak, she gives me a feeling of hope. Every day down there at IU, I think they make a step closer to eventually taking rid of that disease out of our society, and that is of breast cancer. And when I hear her speak, I have hope in my heart that my daughter won't have to worry about this anymore, and that most certainly her children, it'll be done and it'll be over with. And I've never seen somebody with such a sense of passion that Dr. Malkus has, and of course, everyone at the Vera Bradley Foundation for Breast Cancer. We're so blessed to have them all here with us and so close in Fort Wayne. They're very, very proud. And the work that they're doing down there at IU is just unbelievable. I don't understand all of it, but it's really, really good. That part I get really well. We're going to enjoy her tonight.
I can understand it when she explains it to me when I interview her, and then I have to then explain it to other people, but we'll let her explain everything tonight. I also interview Dr. Deb McMahan quite often as the health reporter, and she is the Allen County Health Commissioner. She's served in that role since the year 2000. In her position, she promotes healthy lifestyles and works to prevent injury and disease for all 350,000 Allen County residents. Dr. McMahan is an Indiana native. She earned her bachelor's from Purdue University and her medical degree from the Indiana University School of Medicine. Please welcome Dr. McMahan.
Welcome, everybody. I'm having to say I'm feeling very plain right now. I've got a boring suit on and I can't hold a tune, so all I've got is data here. So bear with me. You have to listen to me to get to the good stuff, which is Dr. Malkus. But I was asked to talk about the health issues of Allen County and how that affects women. And I think that's so important because all of the accomplishments we have yet to do requires us to be healthy. You need to be healthy to be maximally productive in your relationships, in the work setting, our young people going to school, our young people singing. All of that stuff requires health. And we have a lot of work here to do in Indiana and Allen County, and we're going to talk about that today. So I don't want you to be depressed about the information I'm going to share with you. Look at it as the baseline, and we as a community of women, of strong women, are going to be able to move that needle and move us forward in becoming healthy, okay? But we're going to start. It actually worked. I never have the remote work. This is actually exciting. But I want to talk about, first of all, who are we as the women of Indiana, of Allen County, of Fort Wayne? So we're going to talk about that we're greater than 51%. We have a slight edge on the men here. We're very diverse, as you saw earlier this evening. We're at various stages of life. We have young women, we have middle-aged and older women. We come from very different backgrounds, which again you saw. We have some shared health issues that we all need to work on, and then there are some people in our community that have separate, more difficult issues to face. And we're going to talk a little bit about those as well, and then we're going to end up with what's good about, what gives us hope for the future. Like I said, we're greater. We actually represent over 51% of the population, and I have to mention this couple here had been married 81 years to each other. So that's pretty exciting there. I don't think I'm going to make that, but that's a laudable goal. We're very diverse. There was a study done by John Stafford here at IPFW, and there are over 26 languages and over 90-some dialects spoken in Allen County alone in the school system here. So we're a very diverse population. We're at different stages of our life. About a quarter of the women here are young. About 12% are mature, and then the rest of us fall somewhere in between. We have very diverse backgrounds. I've seen people here while I've been treating patients here in Indiana and Allen County from rural settings to the suburbs, urban life, other cultures, and even refugee camps. So we've come here with a very diverse background. But let's talk about some of the issues that all of us women, no matter where we came from, share. Depression. Mental health is an often ignored, not discussed kind of topic, but it's so important for women and men, actually, to understand it, to recognize it, and for doctors and other healthcare providers to query people about it so we can identify this, because we have good treatments available now. And depression is those times when you feel sad more often than not, when you have sleep disturbances or eating disturbances or other types of problems that interfere, again, with that goal of being maximally productive. Unfortunately, about 1 in 8 women will actually suffer depression at some point in their life. And we're not talking about having the blues or being a little bit down. We're talking about people whose mood, and often accompanied with anxiety, actually interferes with their ability to do what needs to be done to make their life better. We suffer it disproportionately. Women are much more affected than men. We have twice the rates of depression that men do. Unfortunately, our young women are also becoming depressed. About 10 to 12% of young women are actually depressed, clinically depressed. While it occurs at any age, middle age seems to be the time, that sandwich generation where you have all these responsibilities. You may be trying to work, your parents are getting older, you have to help them, your kids are young, they need help, your husband always needs help. You know, that's a time when a lot of women feel overwhelmed and can get depressed. And it's not just that women are more sensitive or anything like that. We do know that there are biological reasons why women have this. We think differently, different parts of our brain light up, we're more sensitive to things, we have hormonal issues. All of those things really contribute to this higher rate of depression in women. If we look even in Allen County, we're very fortunate. In 2006, we partnered together, the safety net organizations partnered together to do a study of low-income folks. And we were able to compare that to a study that Parkview was doing on all people in Allen County. And we have the results here that show you that, again, you can see that women suffer more than men from depression, just as we just recently talked about. We can see that, you know, almost women of all ages, though, admitted to being depressed. Poverty seems to be a big indicator for depression, and that's something that's not just here a local phenomena, that's something that we see everywhere. And you can see even in Allen County, the average rate is 17%. Now remember, this was done in 2006, before all of the chaos and all the uncertainty that's occurred with the financial problems in the last few years, so I would expect that number to be even a bit higher. Obesity. Ladies, this is a problem. We have got to do something about this, and I include myself in that little admonition as well. The Trust for America's Health is actually a great organization. They do annual surveys of states, and they create these rankings and these state profiles, and you're able to find the information where your state ranks compared to other states, and they publish it every year. And last year we were 17th in terms of all the states. We ranked 17th in terms of adult obesity. About 36% of African American, 27% of Latinos, and about 28% of Caucasians here in Indiana were obese. Now, I'm not talking chunky, I'm not talking a little pudgy, I'm talking about obese. I'm talking about where we need to start worrying about the health consequences this may have for us in the future, okay? Disturbingly, 15% of our kids are obese. Again, we're not talking about just baby fat, we're talking about people that meet the clinical definition of obese. Again, these are going to create problems that we need to worry about. Now, the good news, bad news is that the year before that we were 11th. So we're actually getting a little better, because you don't want to be number one in this case, okay? The bad news is the only reason we actually ranked better was because everybody else around us got fatter. So it's not like we actually lost weight, but everybody else gained weight at a more rapid rate. So, but this is something that, you know, I joke about, but this is something we really need to work on. We need to get more exercise into our daily life, more walking. You know, we need to eat a little bit more sensibly, because this will have an impact. And one of the most dramatic ways that you can see the impact is through the development of diabetes. And on here is a graph. You can't be a statistician without getting up here and talking about stats, and have to have a couple slides, so bear with me. But here you see on the graph, if you can see on the far left, we're starting in 1958. This is from the CDC, and then following the percentage of the U.S. population that actually has diabetes. And on the end, we have year 2006, I believe. Look at that line. And if this were carried on out to 2010, it would be up to 9% of the population has been diagnosed with diabetes. And everybody knows all the potential complications associated with diabetes, the vascular, the heart problems, the potential strokes, the different cancers are linked to it, arthritis problems, depression, all of those things can be related. Diabetes, of course, can be related to obesity. And just look at that line. And that's not just for adults. We're seeing a similar trend now with kids, because again, obesity is one of the biggest risk factors for the development of diabetes. So we got to look at that graph. And here's just a little slideshow I think is really interesting. You look at 94, look at the color of Indiana. We get darker and darker. Up until 2008, 9%, over 9% of our population is considered obese. Okay, that's not good. And here you see kind of on the top bar, you're going to see that same demographic where you see that's the obesity, and then right below it, just look at the same time periods, the development of diabetes. It just goes hand in hand. And so this is something that we need to stop, not only for our kids. Women need to be equally concerned about their own health as they are about their children and their husbands. A lot of women are nagging their husband to get in there and get his prostate checked and all that kind of stuff. We need to be concerned about our own health. And this is one simple thing that we can do to be able to prevent complications, is just to be fit. And you don't have to be slim, but you need to be fit. What's happening? All right, where's the AV guy? Thank you. All right. I'm not allowed to go out in public and speak without talking about smoking. Okay, that's just a law that they've given me, and everybody knows it. Who here doesn't know that smoking is bad for you? Do I need to go over all the stats of how bad it is? Everybody knows that it kills more people than almost every other bad disease we know combined. Unfortunately, people do still smoke, and we are always, that's ranked every year, and we are always in the top 5 or 6 of states that smoke. Thankfully, Kentucky usually just beats us a little bit, so at least, you know, we're not number 1. But here you can look and see the latest data that we have shows that about 28% of Indiana men, adult men smoke, and about 24% of adult women smoke, compared to the national averages, which are significantly less than that. We need to really work on this because it is a devastating habit, because it does create such disease. Just when you are right, you got the kids out of the house, the kids are gone, you and your husband are getting your second wind here, you're feeling like you know the job, you got a handle on life, and then you get sick. Then you get lung disease. Then you have your first heart attack. Then you're diagnosed with cancer. Don't let that happen to you. Don't let somebody make money off of giving you disease. And then I'm going to stop. Except, wait, I got to talk about smoking and pregnancy. This is really disturbing because we're really high up. We always are in the top 5 of states where women smoke while they're pregnant. Everybody knows that's bad. I don't have to tell you all of the things. The most common problem that we see with that is low birth weight, higher rates of SIDS. So again, there's no reason why we need to be smoking during pregnancy. Smoking in teens, the good news is that's going down. That is good news because in 2000, 32% of our teenagers in Indiana smoked. And it's going down slowly but surely to about, I think it's like 21% now, or 18% in 2008. So that's good news that our kids are not taking up the habit. The reason it's so important that kids don't do that is that we see that kids who smoke, we know, are going to be more likely to engage in high-risk sexual behaviors. They're going to be more likely to drink and do drugs. So again, that's an adult behavior that we don't want them to emulate. So, and I'll tell you, you cannot tell your kids not to smoke and have them believe it if you do. You just need to know that. Again, when we look at the disparities in terms of smoking, we see that Hispanic and Caucasian have the highest rate of smoking there. So again, that's something that you need to keep in mind when you're talking with your kids. STDs. Our young people today are faced with a whole different world than you and I had. There was no internet. There was no texting. The world is a very different place for our young women today, and I really feel for them. They're under a lot of pressure to have relationships that they're not ready for, to do things that they're not ready for, and they don't understand even the health significance, let alone the emotional significance. We women need to really talk with our young people and make sure that they're making decisions for themselves, not being pressured into making a lot of different decisions. I work in our STD clinic here, and I can tell you stories that you wouldn't believe. And it's right here in Fort Wayne. We need to make that stop. And I think that women talking to girls, talking to young women, is the best way to make that happen. They've got to learn to feel good about themselves, that they don't need a man to tell them that they're pretty. They need to feel good about themselves just because of who they are. And we need to be the ones to tell them that. We need to help shape who they're going to become. Because if we don't, this is what we see happening. The top bar are women with chlamydia. And you can just see in the last 15 years or so, look at that rate, how it's gone up. And I hate to tell you, but Allen County is always much higher than the national average in terms of chlamydia. And those are the cases that we know about. Unfortunately, a lot of people are asymptomatic. They don't have any symptoms, so they don't even know that they have it. So again, this is a problem for our young women today that you and I largely didn't have to face. Again, looking at age and sex, for some women, I guess because women are more likely to be symptomatic, we diagnose it more in women. You can see on the right, we have the percentage of women. You can see that it's women between 15 and 24, and that's what we see here in Allen County. That age, remember that your brain doesn't really physiologically mature until you're about 25. And the area that develops last, I don't know why the Lord did this, but he did, is the judgment.